For 19 years, Humphrey Egesa and his wife Celine Mureka have literally camped in their two-bedroomed house in Kabati Estate in Naivasha and various hospitals in the country. For the period, the two, who are flower farm workers and parents of the 2 boys and 3 girls, have shifted from one hospital bed to another as they battled sickle cell disease affecting their children. Out of their 5 children, 3 are suffering from the genetic condition that has left them partially disabled but strong enough to face their daily struggles.
Walianza changamoto yao kama msichana alianza akiwa na miaka 2. Hiyo ni mwaka 2003. Ingawa hatukufahamu ni nini ambao ilikuwa inamsumbua. Lakini baada ya kukimbia hospitali hapa Naivasha na kule Nairobi Kenyatta, basi ikagunduliwa kwamba mtoto huyo ako na shida ya sickle cell. Basi kuanzia hapo tulianza kwenda Nairobi mara kwa mara. Kila mwezi tunakimbia Nairobi, na mwisho gharama ilipokuwa ni juu sana, ni tukaomba ya kwamba ni mzuri turudi hapa Naivasha, ni kwa sababu matibabu yalikuwa ni yale yale, na wakatukubalia kwa sababu tulikuwa tunatumia sehemu kubwa sana.
The problem dates back to 2003 when their 2-year-old daughter and the second-born started getting health complications, forcing them to seek interventions from various hospitals. With a distant look, Egesa narrates how the rare condition has left his second-born girl and 2 boys with walking difficulties.
Mwingine ambaye anamfuata pia kaanza kupata shida hiyo, na basi pia tukaanza kwenda Kenyatta, kwenda North Kinangop Mission Hospital, Kijabe. Basi tukazunguka mahospitali hizo zote, na ikawa ni shida kubwa sana kwa sababu wakati mwingi wanahitaji damu kuongezwa. Wa mwisho mara anaongezewa damu mara niseme karibu baada ya miezi 3 anahitaji damu. Mwingine huyo karibu miezi 8 anaongezewa damu. So ilikuwa ni shida kubwa sana.
His wife Selina Mureka terms her children as the best gift ever from God, despite the pain and agony that they have undergone. She remembers one time when 2 of the minors were admitted in Naivasha Sub-County Hospital, and she had to literally shift from one bed to the other for over a month.
Tumezunguka Nangina Mission Hospital, tukahama kutoka nyumbani tukakuja hapa. Mimi nilikuja ya 2002 January. Nikapata kazi as a supervisor in a flower farm. Mtoto bado ni mgonjwa. Kuna siku moja niliomba ruhusa kazini, niliambiwa nikuja na mtoto mpaka kazini na manager in one of the farms. Nilipobeba mtoto hakuwa vizuri. Kufika tu kwa gate, radio calls zilianza kupigwa, hapana mtoto atolewe hapo. Tukaenda akatibiwa, tukarudi. Akifika 4 years and a half, kuna private hospital nilikuwa nampeleka. Huyo daktari akasema hapana, lazima umpeleke Naivasha sasa apimwe.
And as they battled with the condition, they were blessed with a boy 2 years later, only for him to develop similar challenges. The 4th-born, by virtue of the genetic inheritance, would escape the disease, but their 5th-born, who is now 9 years old and in class 5, will not be spared.
Mdogo ambaye tuko naye Bravin, ambaye ako class 5 sasa, naye amekuwa na shida, undergo operation ka 5. Kuna kati alivunjika kwa shule akafanywa operation. Kuna hiyo changamoto zinazokuja na hiyo sickle cell. Mkono ikafura, tukapeleka yeye kule Kijabe, tukapeleka Kinangop, another operation.
He says that the family has struggled for years in seeking treatment for the 3 children, adding that he has never given up despite the disease bringing the family to its knees.
Wananiambia wanataka mtoto afanyiwe surgery, Sandra. Mimi nikamwambia sina deposit ya 36,000 sababu alikuwa anataka 66. Bravin alikuwa amefanyiwa hiyo mguu mwezi wa 7. due to osteomyelitis. Baba yake akawa na shida ya kichwa, amefanyiwa Disemba. Januari naambiwa Sandra afanyiwe. Nilisema hata kama ni shimo ya pesa inaishanga. Hapo sasa ni kumrudia Mungu totally. Na anaenda form 1. Tukafanya shopping, nikampeleka shule. In the first place, matron hangeelewa. Nikaambiwa hata kama ni saa 8 usiku tutakuita, nikasema mniite. So ilikuwa unaitwa, unaenda unachukua mtoto, unapeleka district, anatibiwa. Pengine amelazwa, unakimbia kazini. Ukifika kazini, target iko mbele yako because I'm a grader. Lazima umiti ile target.
The hope and prayers propelled him. Their 19-year-old daughter is now in college, while the other 2 boys are in primary school, although under follow-up.
Nashukuru Mungu ya kwamba the girl is now 19, ingawa ilikuwa inanihaunt kila wakati na kumbuka kwamba mtoto huyu wakati wote anaweza enda.
His marriage has also been tested time and time again, but he has never given up on the hope that things will one day be okay.
Hata kuna wakati madaktari waliniambia kwamba I don't have a family and therefore wakona hata nafasi hiyo ya kuniandikia barua ili tuachane na mke wangu. Lakini namshukuru Bwana kwa sababu kama hangekuwa Yesu huyu labda singestahimili.
27 years later, their firstborn child is proudly a clinical officer, having overcome all the challenges, and the siblings are following closely on the path to success.
Wa kwanza ako na 27 years, yeye sasa amemaliza college. Yeye ni clinical officer. Alimaliza intern juzi mwezi wa 5. Tuko na Sandra ambaye ako college first year, 19 years. Ako pale Kabete National Polytechnic anafanya medical records. Tuko na Brave Knowledge Baraka ambaye ako na 17 years. Ako form 3 kule St. Mary's School Yala. And then tuko na Eliud Mukia ambaye ako 15 years, ako St. Mary's School Yala form 1. And then tuko na Bravin William ambaye ako 9 years, ako class 5 hapa Milimani Primary School.
The 3 children have faced immense pain and stares from the public who do not understand their condition, and at times they felt like giving up.
Nakumbuka kuna wakati Sandra akiwa mdogo tulikuwa na shida sana, alikuwa analala katikati yetu. Mama upande ule, mimi niko upande huu, na hiyo miguu inakuwa ni very painful. Very painful. Hata kuna wakati ni ukienda hospitali watu wanakuuliza hii ni shida gani? Na unakuwa hata mtu ambaye unachanganyikiwa. Nakumbuka kuna wakati aliumwa akaniambia, "Daddy, si miguu ikatwe?" Nikamwambia kwamba utakuwa sawa.
Knowledge pia ameachana hip joint kwa mguu ya left. Mguu imekuwa fupi. Wanatumia kiatu. Bravin mguu yake ile ya kwanza ili develop osteomyelitis. Ikapasuliwa na ikawa wataikata. But kwa ajili ya Mungu mtoto alipona, haikukatwa.
Medicines are costly, and the couple has to struggle to make ends meet. In a situation where all the children are in hospital, the mother is forced to stay home and cater to them.
Kwa mtoto mmoja unakuta kwamba minimum unaweza tumia in a month ni kama 10,000. Kwa hivyo inakuwa ni shida sana kwao wanapokutwa na crisis. I may call it a crisis. Inapo develop kweli wanakuwa na uchungu mkubwa sana.
Covid19 has affected this family. The children require blood transfusion monthly, and due to the pandemic, the commodity is now rare.
Sasa kama wakati huu imekuwa ni shida sana wakati wa Covid19, tumekuwa na shida sana kwa ajili ya damu hiyo. Wakati mwingi unakuta kwamba hospitali unaenda unakuta kwamba haiko. na zile matunda, kuna matunda ambao huwa tunatumia zinaitwa beetroot, na wakati mwingine pia zinaleta shida wakati ametumia sana na damu ikipanda sana, tunakuwa na ile what they are calling overload.
It has been a long journey for the Murekas. Their only prayer right now is that the government will consider ensuring that there is enough supply of sickle cell drugs.
Madawa ambao wanatumia, they are very expensive. Hydroxyurea kuipata ni changamoto. Ni lazima uende Nairobi, and wakati mwingine labda kama karibu inaenda kuisha, unaweza tembea the entire chemistry ukuta kwamba haiko.
Preston Otega, a clinical officer at Naivasha Sub-County Hospital, says that stigma has been the biggest challenge in dealing with sickle cell.
Stigma has been there, but I tend to think it's because most people don't understand the condition. And this is why Kenya Hospice and Palliative Care found palliative care departments being very useful for all hospitals. Because this is the only place you'll get a patient and family and the clinician spending more than 30 minutes together just discussing their challenges.
I sat down with Dr. Kibet Shikuku, a consultant hematologist and lecturer at the University of Nairobi, about sickle cell disease and its future prospects for cure.
So sickle cell is a blood disorder that is actually associated with an abnormality with one of the structures within the red cell. So generally there are three major components in a red cell. The first component obviously, is the structure, and within the structure is what we call the membrane, and then you have contents inside the cell. One of the contents inside the cell is hemoglobin. Then, of course, for the cell to function properly, you need enzymes, because the red cell does not have a nucleus or a nuclear material. So those are the three major components in a red cell that are essential for it to function. So when you get an abnormality involving the hemoglobin component, then you end up with sickle cell. And actually, there are two chains within the cell. There's what we call the globin chain that is affected for sicklers. So basically, sickle cell is an abnormality involving this chain, where cells tend to form an abnormal shape. We call it a sickle shape.
It is estimated that 6,000 children are born with sickle cell disease here in Kenya, with 50 to 80 children dying before their 5th birthday.
Truthfully speaking, there are various anecdotal pieces of information for sickle cell in the country, because we've actually not done a national surveillance to establish the exact number of patients. But I know people have given us ranges of between 60 to 80,000 patients with sickle cell. And then, of course, we have various regions in the country where sickle cell is relatively prevalent compared to other areas. We know that Coast, for example, has quite a number of sicklers. You come towards the western part of the country, with, again, a large number of sicklers. So if you look at any population, possibly maybe dealing with between 1% to 2% of its population suffering from sickle cell.
Sickle cell attacks major organs of the body, mostly liver, kidneys, heart, eyes, bones and joints. This usually occurs when the abnormal cells get stuck and clog the flow of blood to the tissue that is supplied by blocked vessels.
It is a disease that you are born with. You are likely to stay with it for the rest of your life. And diseases where one has to suffer the consequences, around the disease, we talk of a chronic condition. So sickle cell is one of those chronic conditions that we've seen devastate, lives generally, to the extent that if you're not dealing with morbidity or other complications associated with the disease, you can actually also end up with mortality. And more so, the quality of life then gets heavily affected for those that can survive for long. When it comes to treatment, there are various things that people try to look into. One aspect is to try and look at approaches to treatment associated with the complications of the disease. That is one, and actually that is the overall approach to treatment, trying to allay complications associated with the disease. The second approach is to try and see whether you can actually cure the disease. So those are the two major approaches to treatment.
Technology has come in handy, and there are newer methods that are in use to control the disease.
People have also attempted to use various approaches to treatment, and here sometimes you want to look at mechanisms to remove these abnormal cells and replace with normal cells. We call that red cell exchange. It is a relatively new concept, but it has been practiced in some countries. In Kenya, we have attempted to, introduce this mode of treatment for a few cases, so that then you can taper the amount of these abnormal cells in circulation.
Management of sickle cell involves eliminating pain episodes of the patient, relieving symptoms, and preventing complications. Genetic sequencing is one of the treatment options.
Remember now, genetic sequencing, or rather gene therapy in general, is a new concept that is being followed up by different programs, different disease groups or disease entities. I know of a patient actually I met sometimes back in South Africa who had undergone genetic therapy, but the problem is the take can be very poor. So it is a new concept that can actually be used to cure a disease process, because when you want to manipulate the gene so that then whatever end product you have is able to produce normal cells, then you end up curing the underlying disorder. But the challenge, as I did mention, is that it is not readily available. It is not reachable to majority of people generally. It is still under research. So a lot is still yet to be invested on gene therapy in general. But of course, there are many other modalities that are being tried that may not necessarily be gene related. A lot of countries are now attempting to use stem cell transplantation as a quicker means to cure sickle cell disease.
Kenya still lags behind in treatment options and less amounts of medication that are direly needed.
I don't know if you are aware that Tanzania is actually much ahead of us in terms of sickle cell management, and I guess this is because the government is heavily investing on trying to change the trend in care for sicklers. So as a country, we are not yet even there. We have not even started stem cell transplantation. One of the things that clinicians have attempted to use is to try and see how to reduce production of this particular abnormal cell. So there are drugs that actually are given to patients to try and enhance production of other cells other than this sickling cell. One of the products that we naturally use, which is actually the gold standard for care, is called hydroxyurea. So other than preventing this patient from exposure to many other diseases, hydroxyurea, which is a drug that we use actually for managing cancer patients, has been found to be safe for sicklers. And what this drug does is it enhances production of the younger cell we call fetal hemoglobin, okay, or younger hemoglobin that is found in the fetus. Now that cell does not necessarily break down easily like the sickled cells. And as I said, this kind of drug has been the gold standard. That has been used for several years.
Statistics show that huge numbers of sickle cell cases occurs in Africa. However, there is no conclusive evidence of the reason.
If you look at Africa as a continent, we have a lot of parasites that have been associated with the disease, and apparently malaria is one of those. And what has been found out is that people who have this abnormal gene, especially in malaria endemic zones, have a protective effect against malaria. And so nature tries to take care of itself by producing a cell that then can be able to manage another insulting agent like malaria. So those are hypothetical explanations that we have associated with this particular gene.
Dr. Shikuku says that it is time the country invests on research for sickle cell and bring in more technology to curb the disease.
We can actually taper complications associated with the disease by just using basic modalities of care, like replacing the abnormal cells with other normal red cells through the red cell exchange. And we have platforms that can actually do that. You and I can easily donate blood, okay? Because we know our blood is okay, and that blood can be given to someone else. It is a little different from blood transfusion. Remember, when I transfuse you with blood and you're a sickler who is destroying more cells, if I added you with more blood, one, I'm adding you with more poison. Okay, it's a modality of care. But then the challenge is you end up giving this person a lot of iron. So you overload the patient with iron, and iron has its own problems. With red cell exchange, what happens is that you are able to remove what you don't need and replace with what is of value. So basically that is one quick gain. The second is we need to provide hydroxyurea in large quantities and transition most of our patients to hydroxyurea. Now, as a country, trust you me, I don't know why there is a lot of lethargy to use hydroxyurea. People have not seen the need to use hydroxyurea. And hydroxyurea, as simple as it is, can actually give you miraculous outcomes. So we need to try and transition most of our patients to hydroxyurea so that then we reduce the complications associated with the disease.
Saada Hassan for Health Digest.